Welcome to today's press briefing. We have Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Linda Yu, Chief Manager of Hospital Authority. Dr. Zhang will give you an update of the cases today. As of last night, we recorded 32 confirmed cases, with case numbers ranging from 9019 to 9050. Among them, one is an imported case and 31 others are local cases. Among the local cases, 9 are untraceable cases. As for the remaining 22 local cases, they have linkage with other cases, including 4 cases in Princess Margaret Hospital involving patients and staff of PMH. They tested preliminary positive yesterday. And there are 18 other cases, including a close contact of a confirmed case of Nam Tin Chang Kwan O Tunnel. For the untraceable cases, we have a registered nurse at a clinic whose duties include answering phone calls and providing patients' records to the doctor. One is Nathan Road, Mongkok. The other clinic or workplace is in room 230 of Ho Man Tin Plaza. The first clinic is in Ngau Nga Ngan Hong in Mongkok, and both clinics involve several colleagues, namely 4 nurses and 2 doctors. There aren't any close contacts of the 2 doctors because both doctors had meals on their own and they had all been wearing masks throughout. And we've asked the clinics to suspend this operation for 14 days and for staff to be tested. This patient last went to work on the 2nd of January, and during the infections period, for the patients that the nurse got in touch with, we have a list and we will invite them to do the test. As for case number 9032, he is a trainer in a severely mentally handicapped hostel, and these residents will be asked to undergo tests. As for 2 residents, they are regarded as close contacts and they will be quarantined. We have 3 buildings added to the list of specified premises with 2 flats unlinked. One is Checkman House of Check Fong Garden. The other one is Block A of Ruby Cinema building, and the other is Wang Hei Court of Bohei, or Wang Hei House of Bohei Court. At least 2 or 3 persons are involved in each of these buildings. They've tested positive, and at least 2 units of each building are identified, and these buildings will be subject to compulsory testing. We've also been notified by the Department of Health in relation to patients tested with the UK strain. That's case number 8510. He returned to Hong Kong via CX252 on the 21st of December with family members. The other case is 8962, also arriving via CX2X2 to Hong Kong on the same day. The other 2, 9003, took PR300 and arrived in Hong Kong on the 22nd of December, and the other from Philippines, and the other is 9006, who arrived in Hong Kong on the 2nd of January from France via flight AL847. And the Polytechnic University conducted a similar test, that is gene sequencing. involving case number 8535, who also arrived in Hong Kong via flight 6252 on the 23rd of December. That means we've identified patients with the UK virus strain and also South African strain. Among the 15 patients of this category, 13 of them returned from the UK and 2 returned from other places. That concludes my reporting. Dr. Yu will report to you the situation of the hospital authority. Good afternoon. As of 9 a.m. this morning, over the past 24 hours, the HA recorded 39 reportable cases. In the past 24 hours, 2 more patients passed away in public hospitals, namely Tuen Mun Hospital. So far, 149 patients have passed away in public hospitals. In the past 24 hours, 72 patients have been discharged on recovery. So far, 8,126 confirmed cases and 1 probable case have been discharged upon discovery. At the moment, 707 patients are receiving treatment from 23 public hospitals and the community treatment facility. 48 patients are in critical condition and also 615 in stable condition. 1,261 negative pressure beds are in use with an occupancy rate of 63.1%, and 691 negative pressure units are available with an occupancy rate of 71.8%. And I need to report a number of incidents. In Tuen Mun Hospital, we have a contract supporting staff who just tested positive. The family members of this staff member also tested positive. He's a close contact of the family members, and in the building where he resides, there are also other confirmed cases. Dr. Zhuang already mentioned the building concern, and the staff member took the test in Tuen Mun Hospital A&E unit yesterday. The staff member is not required to enter hospital wards during his daily duties. And upon contact tracing, 3 colleagues had meals with this contract staff, and these 3 other contract staff members would also be subject to quarantine. They're regarded as close contacts. As for the rehabilitation ward of Buddha's Hospital, there is another confirmed case involving a male patient who shared the same cubicle with another confirmed case, and he has been regarded as a close contact and he has been put under quarantine. We'll continue to monitor the health condition of patients in the same ward and the staff members. Previously, in the ward, 1 patient and 2 staff members have already been confirmed. The Central Committee on Infection Control and Emergency held a meeting today, and that's the Central Command Committee on Infectious Disease and Emergency Responses. And members have agreed that there will be step-up screening tests for patients receiving daycare services. Before they're allowed to access the service, they are required to take COVID test. Say for patients requiring dialysis, weekly testing will be provided. As for patients presenting fever symptoms, they will be arranged to stay in an isolation cubicle for receiving treatment. And whilst receiving services from our hospital, no meal service will be provided. And for patients that are required to stay in the hospital for a longer period of time, light meals will be provided with partitions set up. As for tests for staff members, priority will be accorded based on the risk of exposure to the virus, and those prone to high risks will be given priority. For example, colleagues in the outreach units, those providing palliative care, or those in the oncology department. As these patients, as service recipients, are more vulnerable and frail, should they be infected, the consequence would be dire, hence the need for more protection. As for the latest measures just announced, we are ironing out the details and they will be implemented as soon as possible.
Now to open the floor to questions and speak through the microphone and state the media organization you represent. The gentleman in the middle row. RTHK. How many preliminary positive cases today? And for other cluster, for example, the Princess Margaret cluster, do you have new preliminary cases and have also been spilled over to other wards? For the Chung Kwan O Lam Tin Tunnel, yesterday you've ordered compulsory testing. And how many workers need to be tested and how many have give the results? For the infection at construction site, what kind of recommendations would the CHP gives? And just now the HA have outlined their infection control measures. And when will they be implemented? And or the timetable for them? Would you consider separating day care services into morning and afternoon sessions so that the patients will not need to stay for that long? Third question. So within these 2 weeks, we have seen 2 hospitals having outbreaks. Do we need a comprehensive review of the hospital infection control measures? Are you acting behind the clock, and would you apologize to the affected patients? So far, there are over 20 preliminary positive cases. For Chung Kwan O Lam Tin compulsory testing numbers, I do not have them. We recommended them to step up infection control measures. For example, on the containers at changing room or break rooms, whether they can be improved. For HA, so far we haven't had any new preliminary positive cases in Princess Margaret. On the day care services, it depends on the clinical need. That different patients require different treatment. Some may take we try not to provide meals to them, so they need to minimize the time they need to take out their mask. As for the implementation, well, we need to hammer out some details, for example, informing the patients and the staff, and we hope to implement them as soon as possible. On infection control, as the pandemic is developing, and we see that the community infection is still severe. In terms of our PPE and admission screening, we have done a lot of work. Our testing capability have also been enhanced, and we have told our colleagues we should get our colleagues tested as quick as possible. We would like to strengthen these measures to step up infection control. The lady in the front, Main Pao Daily News. As like the case, the Cheng Hong Community Day Rehab and Residential Service, why a staff getting infected would have 2 residents sent to quarantine? Would other staff need to sent to quarantine? And how many individuals are we talking about? And what is the level of mask compliance at the facility? And for the confirmed registration nurse working in 2 clinics, can you give us the name of the clinic and how many patients had she dealt with, and how was she exposed to the patients? A question for HA. Do you have the results for the environmental samples at Princess Margaret, and how many of those have tested positive? Have you found the virus at the switches? Should healthcare staff get tested regularly, and how regular? Can you provide such details? For the rehabilitation facility, since the latest case is a worker. We'd like to know if other persons are affected. That's why we're testing both the staff and the residents. The staff was responsible to, during the infectious period, responsible to take care of the 2 residents. They will need to get tested first. And we still need to check if there are other cases. If there are a cluster that the whole facility would need to send to quarantine. Well, I don't have the exact figure. It should be around a dozen. The address of the clinic I've already disclosed. The nurse mainly responsible for registration, taking phone calls, or passing the files to the doctor. Well, for the patients that she helped with the registration, we are still tallying. I don't have the figure yet. For the Princess Margaret Hospital, the environmental samples which they obtain from the ward and the surroundings, the results are being examined. On staff testing, yesterday we have announced that some staff and the patients are subject to compulsory testing. We also urge our colleagues to visit the temporary testing center and get tested inside the hospital, and we recommend them to do so. And for the risk based on the test based on the risk of the patients, we are still hammering out the details. Probably at around every 2 weeks, the test will be held for our staff. Let's take an English question.
Hi, South China Morning Post here. I want to ask, since we are now testing all-day ward patients, will it add to the stress of increasing the test capacity for public hospitals, since we know that there will be a lot of day ward patients? And my second question is about the Lam Tin tunnel construction site. Yesterday you said that, Dr. Chuang, yesterday you said that the authorities may hope to space out changing rooms or introduce regular testing for workers. Has there been any further thought about that measure, and will you hope to implement those measures soon? Thank you.
For testing the day patients, in view of the community cases, conditions is still serious, so we will impose recommendation to test all the day patients. Regarding the testing capacity, from the start of the COVID epidemic to now, we have gradually increased our testing capacity. But of course, we will monitor the situation and whether we need to solicit more support from the community testing center or service provider to increase the overall testing capacity.
Concerning the tunnel workers, those are the suggestions we give to the relevant authorities, the bureaus and the departments, for them to consider.
我答多條英文問題呢邊。
Let's take another English question.
THK English News, a question to Dr. Chuang about the residential blocks for handicapped patients. What kind of activities has the confirmed staff been doing in the centers during his or her incubation period? And will he or she be working in different floors of the same buildings? And do you see chances of an outbreak there? And the second question about the nurses, about the nurse working in the 2 clinics in Kowloon. How likely is she being infected during work? What is the risk of the patients who have been visited there? And the last question to Dr. Linda Yu about the infection in Princess Margaret Hospital. Can you share with us some environmental contamination findings? And has HA stepped up any virus control measure, especially for the daycare ward? And how many have undergone mandatory testing so far? And how many more tested positive? Thank you.
The residential block for the handicap, the RCHD, is not a very big hostel. So the trainer will serve the whole hostel, but he only had close contact with 2 residents so far. That's why we sent them to the quarantine, and we will test all the other staff and the residents to see if there are other cases. And for the nurse, so far it's an unlinked case so far, so we cannot identify any source of infection yet.
Regarding Princess Margaret Hospital, the hospital have taken some environmental samples from the day ward and relevant areas, and they are now examining the samples for the result. And the hospital authority will further strengthen the infection control measures in the hospital by performing screening for day patients. When day patients need to receive service in the day wards, they will be arranged to have COVID testing before they have the service. And we will also minimize the need of having meal in the hospital. And if needed, we will provide light meals instead of a full meal to decrease the time for having unmasked time. And I don't have the data on the mandatory test right now, and we didn't receive any report of further preliminary positive cases.
How likely the handicap center is open?
We are testing them, so we don't know yet.
下一位
Next question. This lady at the back. I'm from Cable News. My question is on the screening test for day ward patients. Will PCR tests be conducted? And is it that only patients with negative result could receive day patient services? Would that cause a delay in the services that should be delivered to needy patients? And about healthcare staff taking care of frail and vulnerable patients, is there a need to conduct regular testing on a mandatory basis? There is another question. For Homentin Plaza that you mentioned, is that room 230 of Homentin Plaza? Because it seems that there is a clinic at unit 229, not 230. Can I confirm the address with you? Also, another question. Experts have suggested that close contacts should be traced. When will it be implemented? Would it be implemented as soon as possible, like screening tests for day patients? And will there be any priority set for close contacts of confirmed patients or groups? Our experts consider different testing platforms for screening day patients. PCR test is one option. For day patients requiring our service, sometimes they come on an emergency basis, so we would try our best and arrange for a test for them. We hope there won't be any delay in delivering services to needy patients. As for testing for our staff, our proposal is to arrange for tests for our staff once every 2 weeks. These staff members will be taking care of more vulnerable and frail patients. So we suggest that our staff members take the test in order to protect themselves as well as these patients. According to my record, it's Unit 230 of Homentin Plaza. As for the tracing of close contacts, we're still exploring this option. Next question. I'm from Echo Daily. Good afternoon. About the enrolled nurse. She started to have discomfort on the 1st of January, but on the 2nd of January, she still went to work. Is it that she did not have any contact with any patient at all during her work? And also about the virus variant. Now, in one of the cases, the patients returned to Hong Kong on the 13th of December. That seems to be the time after the flight ban had been imposed. So is there any risk of spreading the virus in the community? And will a different approach be taken if the variant is spread in the community? As for the 3 new buildings added to the list for compulsory testing, can you explain the correlation of the units concerned? The enrolled nurse had contact with patients at the time of registration for patients. It's not medical contact as such. 8535. During the quarantine period, this patient experienced discomfort and was sent to hospital. This patient did not stay in the community. As for the 3 buildings for Jackman House, 2 units are involved. They are floors apart, but they have the same unit number. As for Lux Theatre Building, Block A, there are a few floors apart and not sharing the same unit number. And Wing Hei House of Bo Hei Court, same floor but different unit numbers. Speakers not coming through. Slight fever. For details, we need to make further inquiries. Next question. This lady wearing a white jacket. Good afternoon, I'm from Oriental Daily. About Princess Margaret Hospital, as of now, how many HA staff have been tested? Any impact on the service level? And about screening tests for day patients, is there a concrete timetable? If you say this will be put in place as soon as possible, do you mean this week or next week? Any more information available? Next question. You talk about bi-weekly tests for healthcare staff. Will there be sufficient manpower for the tests? And according to experts, it is suggested that electronic health records should be introduced. Will this be done? And about the contract staff in Truman Hospital and the 2 nurses, do you have any movement records of them? For Princess Margaret Hospital, 15 staff members have been regarded as close contacts and will be subject to quarantine. As for the arrangements for day patients in the daycare center, we need to iron out details. We hope this will be implemented as soon as possible, perhaps in the coming few days. But then we need to check with different hospitals about the actual arrangements. As for testing for our colleagues, again, we hope this will be implemented as soon as possible. Testing will be done by way of deep throat saliva samples, so our colleagues should be able to provide specimens themselves, but at the same time, our laboratories will also need to enhance capacity. Speakers not coming through. Speakers off mic. Electronic health record, what do you mean? Speakers not coming through. The speaker's not using a microphone. Do you mean to trace the patient? The speaker's not coming through. We have the electronic health record system for patients within the hospital authority, but we do not have a dedicated electronic database for COVID patients for the purpose of contact tracing. Now, on contact tracing, as mentioned before, OGO is or has been engaged in conducting a study. The speaker's not coming through. The contract staff in Truman Hospital, the family member of this staff member is a confirmed case, so it is believed that the source of infection is in the community. The duties include delivery of documents. The nurse, no high-risk activities have been identified.
黑色外套嘅女士。
The third row, Hong Kong Economic Times. On the day ward patients admission screening, that it will take place 1 or 2 days earlier. Are you worried that they will get infected in the community when they leave? By testing them, would it be done in the hospital and will it be free? Would you accept the testing result from the community centers? And has the ward been closed? And how many patients have been affected? And a question on the anti-epidemic measures. And Professor Sophie Chen mentioned that if necessary, they would consider regulating private or family gatherings. Would Dr. Chang see that as reasonable? Would you find it necessary, and how should they be regulated? And for the registration case, nurse, can you reveal the name and the case number? And for the Cheung Hong Community Day Rehabilitation and Residential Service, what are his duties and where will the residents be sent to? Is it Asian World Expo? For the day ward patients, the point is not to reduce the risk of community infection. It is to allow us to cut off the transmission chain and provide early treatment to these patients. All the patients and individuals should continue keep up with their hygiene. The hospital will arrange testing for them. Can the patients arrange their own testing? It depends on the locations. Hope that they could be done in the government accredited facility. For the Princess Margaret Day ward, the relevant ward currently has suspended its operation. The hospital will look into the manpower deployment and plan to reopen or resume the operations for that ward, hopefully to provide some of the services. First, it shall deal with urgent cases, for example, for the hematology patients. If necessary, some patients will be sent directly to the hospital for treatment or admitted for treatment. I do not have this information at the moment. I only have the address for the clinic, as I had mentioned the addresses for both clinics. The trainer was responsible for training and health feeding. 2 residents we need to send to quarantine center as they were fed by the trainer, and these 2 were sent to Pak Fu Lam. I have nothing to add on the secretary's remarks. This gentleman on the other side. TV News. A few questions. Just now in Dr. Chung's opening remarks, you claim some of the UK variant are seen from the France and Philippine returnees. You consider the need to tighten the policy on other country arrivals. For the over 40 buildings subject to compulsory testing, the deadline have expired. And how many positive cases have you identified, and how many close contacts need to send to quarantine? The third question, for the enhanced measure for day wards, for the staff, they should get tested every 2 weeks, according to the proposal. Can patients would need to maintain the status arrangement, or do they need to obtain the test result before getting their treatment? For Po Hay Court, can you clarify, is it in Wing Hay Court instead of Wang Hay House, rather?
Wing Hay Court, sorry.
Wing Hay House or Po Hay Court. We didn't have a tally of cases caught through compulsory testing. This morning we done a count. There were 16 cases netted from the different buildings. Some from new units and some from units with confirmed cases earlier. I forgot the other part of your question. On the import of variant cases, the UK variant originated back in September, as the people have been flying around. Therefore, we anticipated that it will appear in other countries. It's a matter of testing or whether testing is available and the timing of the testing. Well, currently we found them in the France or the Philippines returnees, and this is anticipated. Currently we are implementing stringent immigration measures. For example, quarantine for 21 days at designated hotels. For enhancing the infection control measures, the day ward patients, we hope to arrange screening in advance so they can get served with a negative result. For some urgent cases, we'll try to explore other testing options so the results can return quicker, or after they get tested, we will put them in some kind of partition as to reduce the exposure to other patients while continuing their treatment. Let's take the last two questions. AM730, a question for Hospital Authority. And just now it was 15 colleagues was set to require quarantine, and how many of them are doctors or nurses or other healthcare staff? For regular testing of the healthcare staff, and how many people we're talking about, and do we need to enhance the capacity, and by how much, or we need to enhance the help of other laboratories? On today's cases, do you have the case number of the registration nurse? For the Cheung Hong Community Day Rehabilitation Service, since the residents were fed by the trainer and required them to quarantine, and how many residents were trained by the trainer, and how would you assess the risk? An earlier reporter have asked about a Hey Yi restaurant have been visited by multiple cases. You claim you had no information earlier, and any update? And for the Meifu San Chun Fu Yun restaurant, a chef was confirmed. And do you have any information? For the Princess Margaret Hospital requiring under quarantine, I do not have the breakdown. For the staff testing, we are estimating the number. There might be hundreds of thousands of colleagues are responsible for taking care of vulnerable or frail patients. For the testing capacities, we can coordinate on that. As they will be done every 2 weeks, we can perform the test in batches. The pandemic remains severe and the testing demand is huge. Besides providing testing to our staff, we won't rule out that we need to engage other contractors for help. For To Kwa Wan, a Happy Together restaurant, there is a cluster involving a few employees, and together with their family members are confirmed cases. The nurse case number is 9029. The trainer 9032. We have tracked down the closest contacts engaging in the risky activities, and also those who exposed to other residents. Therefore, the whole facility would need to be quarantined. Let's take the last question from the back. HK01. For the Princess Margaret Hospital, it was mentioned 7 who need to send to quarantine, and now 15. Were they all from the day ward? You are not have the testing timetable. would the patients require to submit the bottles by themselves or need to come back a day or two earlier, or there'll be a door-to-door collection? This had yet to start, and for the day wards in other hospitals and for those who are prone to fever, and would they need to send to the negative pressure ward directly? For those with less urgent need, would their appointments be postponed?
醫院呢
About Princess Margaret Hospital, 15 health staff are required to be quarantined. Some of them work in the day ward. 2 of them are regarded as close contacts of these colleagues concerned. For patients that would be subject to screening test before accessing our day ward service, this is not just an arrangement unique to Princess Margaret Hospital. The same arrangement would be put in place for all our hospitals. We would encourage patients to provide deep throat saliva specimen to us earlier before the appointment date. As for hematology patients, we know that they are prone to fever, and our healthcare staff would examine the patients, and if need be, the patients will be arranged for further or more detailed examinations in the isolation cubicle. The speaker's not coming through. Well, that depends on the case. For this case, the patient had fever along with other symptoms. So more detailed examinations were required, including the test. Now, having drawn on this experience, we are going to put in place arrangements for the patients.